The two American Ebola patients are making progress this morning. Nancy Writebol arrived at Emory University Hospital in Atlanta Tuesday. She is in the same isolation unit as her fellow aid worker, Dr. Kent Brantly. Our Dr. Jon LaPook is at Emory Hospital tracking their progress. John, good morning.
Dr. Kent Brantly and Nancy Writebol are right here in a secure isolation unit. And now we're learning more about the experimental medication that both of them received before leaving Liberia and coming to the United States. Nancy Writebol had to be wheeled into Emory University Hospital on a gurney by two paramedics in full Tyvek suits, a sign of how serious her infection remains. Although the 59-year-old didn't walk in as Kent Brantly did 3 days earlier, it was still a scene that lifted her family's spirits. The president of SIM, the Christian aid group she works with, read a statement from her husband, David.
A week ago, he said, we were thinking about a possible funeral arrangements. Yet we kept our faith.
Writebol arrived in Atlanta late Tuesday morning after a nearly 15-hour journey from Monrovia, the capital of Liberia. At Emory, Writebol will be able to speak to her family through a window in her isolation chamber. Dr. Bruce Ribner leads the medical team trying to save the lives of both victims.
They can have kidney failure, they can have liver failure, they can have lung failure, they can have bleeding problems, and our job is keeping the patient alive until such time as their body's defenses can control the virus.
According to his wife Amber, Brantly, 33, is in good spirits and continues to improve. Before they left Liberia, Brantly and Writebol received doses of an experimental Ebola drug called ZMapp, created with the help of antibodies harvested from lab mice and mass-produced using tobacco plants in Kentucky.
It was the decision of the doctors and Kent and Nancy whether or not it would be administered.
One of the scientists who helped develop ZMapp told us that human trials are due in 2015. But one of the challenges is that right now it's in very short supply. So it's going to be very important to figure out a way to make sure that there's enough of it to go around. Charlie?
John, thanks.